Ever find yourself struggling to recall the branches of the brachial plexus? It's a question that resonates with many of us, isn't it? The brachial plexus, this intricate network of nerves that innervates the upper limb, is notorious for its complexity. It's like a tangled web of pathways that sends signals from your spinal cord to your shoulder, arm, and hand. For medical students and health professionals alike, understanding the brachial plexus is paramount. It's not just about passing exams or impressing colleagues, it's about the ability to diagnose and treat conditions that affect the upper limb. However, the challenge lies in remembering the numerous branches and their corresponding pathways. It's akin to memorizing a labyrinth, each turn more confusing than the last. So, how can we simplify this complex structure for easy recall? The answer lies in a simple mnemonic device. Mnemonics. These are age-old tools that aid memory by associating new information with easy-to-remember constructs. Now, what exactly are mnemonics? Picture them as mental shortcuts or hacks that help us remember complex information. They've been the secret weapon of many medical students for years. From the cranial nerves to the order of amino acids, mnemonics have made memorizing these complex structures a breeze. Let's take a look at the brachial plexus, a complex network of nerves in the upper body. 5 primary branches, each with a name that seems harder to remember than the last. But worry not, we have a mnemonic that can help. My aunt recalls my uncle. Each word corresponds with a branch of the brachial plexus: musculocutaneous, axillary, radial, median, and ulnar. With this mnemonic, remembering the brachial plexus branches is no longer a daunting task. So, let's dive deeper into understanding this mnemonic in the next scene. Now, let's break down our mnemonic. My aunt recalls my uncle. Each word in this phrase represents a branch of the brachial plexus, and they're sequenced in the order they branch off. My stands for musculocutaneous. This nerve is found in the upper arm and it innervates the muscles in the anterior compartment, enabling flexion of the elbow. Aunt is for axillary. This nerve wraps around the humerus and supplies the deltoid and teres minor muscles, facilitating movement of the shoulder. Recalls represents radial. This nerve runs down the back of your arm and hand, empowering extension in the arm and wrist. My corresponds to median. This nerve travels down the front of your arm and hand, controlling most of the small muscles in the hand and facilitating precision movements. Lastly, uncle stands for ulnar. This nerve affects the medial side of the hand, influencing fine motor skills. By associating each branch with a word in the mnemonic, we've simplified a complex structure into an easy-to-remember phrase. To quickly recap, we've transformed a complex task into a simple one. Started off by acknowledging the intricacy of the brachial plexus, a network of nerves that can seem like a daunting labyrinth to navigate. We introduced the concept of mnemonics, powerful tools that help us remember complex information by breaking it down into memorable bite-sized chunks. Next, we delved into our specific mnemonic for the brachial plexus branches. My aunt recalls my uncle. This mnemonic may not be as shocking, but it's certainly memorable. Each word stands for a branch: musculocutaneous, axillary, radial, median, and ulnar. This engaging, unforgettable phrase is your new secret weapon in mastering the brachial plexus. We hope this mnemonic will make the complex simple, turning the brachial plexus from a daunting challenge into an easily navigated map. With this mnemonic, mastering the branches of the brachial plexus is now within your grasp. My aunt recalls my uncle. Happy studying.